Hi, my name is Dr. Bertina Hooks, and you're on my Facebook page. I wanted to share a little bit about myself, and so you could get to better know me and the person that I am and why I chose to pursue medicine and practice medicine. I was born in the Midwest from middle-class family, and I've always wanted to be a physician since I was 5 years old. I wanted to become a physician because I wanted to help people, and I really like science and math. And I kind of had that passion since I was very small, and I pursued it with all of my effort since then. And I have now a successful practice, and trying to develop a successful practice and grow as a clinician, as an educator, as a human being. And so I wanted to share a little bit about myself and why I do what I do and who I am, so that you can get to know me a little bit more personally. I went to school at Creighton University in Omaha, Nebraska. Go Blue Jays. And I had a very great clinical training there, and I was very happy with my experience there. And then I went on to practice medicine in Atlanta, Georgia, and now I'm in California. I am an internal medicine board certified physician, and so that means that I address health concerns and complaints of adult patients, ages 18 to until we depart this earth. And I like the complexity of my job. I like multitasking. I like being an educator. And I think I'm a very good patient advocate, and I try to teach my patients about their own health and kind of be more in the driver's seat. So I think it's a very fulfilling job. I used to work as a hospitalist, and I work as more in outpatient medicine, so that I can be home more with my 5-year-old daughter. And I love to go traveling. I love to, see different cultures and learn about different people and how they live, because I think we all are more similar than we are different. And finally, I love to read. I love music. I really enjoy interacting with people, and I'm a people person, and I love a sense of humor. So that's just a little bit about me. And I hope that you have a better sense of why I wanted to pursue medicine and the person that I am. The main thing that made me want to pursue medicine was the fact that my sister was born premature and was hospitalized at University of Iowa Hospitals and Clinics when she was an infant. She was born 5 months premature, and she was hospitalized there until she was 9 months full term. And she had a lot of medical issues. And we kind of really pulled together as a family and spent a lot of time in the hospital. So the hospital became a very familiar place for me at a very young age of 5, 6. And then later on, when I was in high school, I got involved in a very tragic motor vehicle accident, and I was hospitalized. And the ER physician asked me what I wanted to do when I grew up, and I said I want to be a physician. And he gave me his stethoscope, and I still have it today. Also, when I was 5 in kindergarten, I would draw pictures of what I wanted to be when I grew up, and I always wrote I wanted to be a doctor. So I had a pretty keen sense of what I wanted to do and what that meant. And then as I grew, I did a lot of volunteer experience in the hospital, worked as a volunteer at Allen Memorial Hospital. And I also shadowed a lot of physicians, cardiologists, and oncologists, and other doctors. And I decided I wanted to be a surgeon or internal medicine doctor. And I actually did an obstetrics and gynecology residency first before I matched into internal medicine. And I can expound on that a little bit later, but that has given me a broad experience and knowledge base in women's health as well as adult medicine, and I still utilize that expertise today, even though I don't deliver infants anymore. So that's a little bit about me. I hope that you've enjoyed listening to this video. And if you have any additional questions for me or want to know more about me, please don't hesitate to ask. And I will be posting on Wednesdays some wellness talks, which will talk about different topics, health topics that people in the community have said that they wanted to know more information about from their physician. So as a physician, I want to impart knowledge and be an educator to my patients in the community at large. And so I think it's a good platform to use social media to do that. So I look forward to talking to you very soon. Have a wonderful evening and weekend, and be safe out there. Take care. Bye.